am one of them. However, only 5,000 people can get heart transplants every year.
So as we see this graph, the amount of people that have received a transplant is very low, and there's a higher chance of people in the waiting list, and that's not a good look for it.
Why is this number so low? Why are there so many more people on the waiting list compared to people getting a heart transplant? This is because the criteria for getting a heart transplant is extremely specific.
Lake Nona Surgery Center, are you eligible? Good morning, my name is Aiden Corzo.
My name is Lucas Ragnanian.
My name is Cameron Schamberger.
My name is Priyanshi Gandhi.
And I'm Crystalise Loriano.
Our chosen candidate, we decided to choose candidate E. We chose her because she is a 35-year-old woman. She's currently unhoused and is suffering from severe chest pains. And after a lot of research that we did, we found that she has no family to speak of and no health insurance.
This is our patient criteria. Financial situation. How does candidate E's financial situation impact our hospital? Next, health viabilities. What is the health viability of candidate E? Lastly, we have lifestyle. How does the lifestyle of candidate E affect how she can get a heart transplant?
Here are the financial and political impacts on heart transplants for patients. The transplant costs a whopping $1.4 million. Insurance coverage is Medicare, which basically covers half of the proportion of the procedure for patients who are unable to pay for it, like candidate E. Financial difficulties for patients like candidate E could be challenging since she is uninsured, and potential benefits for hospitals with uninsured patients means that they get more money. As you can see in the image here, it shows how organs and transplants vary with the price of it. These expenses can also affect the patients without the help of Medicare. Some of the hospital revenue from the heart transplants, hospitals earn a significant amount of revenue from the heart transplants due to the high cost of the procedure, which is around $1.4 to $1.6 million. And while the insurance typically covers a portion of this expense, uninsured patients can lead to higher amounts of money in which the hospital makes.
And adding to that, there is insurance laws that have to be added to get a heart transplant, and in order there is some coverage requirements, which most of the policies, they're covered medically into the heart transplants, and they scope around between the pre-transplant evaluations, which are the transplants that people have received before, and like post issues that they had, so that also affects in what they can receive and how it will affect them after receiving a heart transplant. And the pre-existing conditions, the laws, they often protect against denial of coverage due to their past issues that they've gone through.
One of our values was lifestyle. A pro of lifestyle habits is the patient has no known unhealthy lifestyle habits, making her a valuable choice for the transplant. However, our candidate does not have a social support system to prevent unhealthy lifestyle habits after the procedure. This could impact physical health. Additionally, social support. COTS, a study from the Iranian Journal of Nursing and Midwifery Research, discusses how patients need support from family and friends after the surgery. However, a negative impact is candidate E having no support from family. In the graph above, respondents were asked how the surgery affected their relationships. The highest category is family ties being strengthened. Under lifestyle, we have mental health. Person E has no existing family, therefore less stress because they don't have to worry about family problems, essentially leading to a faster healing process. However, candidate E's mental health may worsen due to lack of family support. Adherence to medical advice is how well the patient listens to the doctor's rules. Our candidate is prepared for surgery. As a result, she has a positive attitude going into the exam. A con includes patient E having nobody to hold them accountable after surgery. In the image above, we see how social support affects the number of physical activities completed.
To add on to that, our last criteria was health viabilities. The organs needed for planned transplantation need to be preserved for a short period of time. Therefore, we need to pick who is most optimal. Candidate E has severe heart problems, so we feel that she is most optimal for our surgery. Other medical histories we take into consideration is cancer, like cancer history, their medical background, and the location of the donor.
What is the United Network of Organ Sharing? The United Network of Organ Sharing is a global network of transplant hospitals dedicated to making heart transplants around the world more cohesive. So it is basically a nonprofit organization that makes all of the rules and basic criteria for heart transplants. The one thing highlighted on the United Network of Organ Sharing is that the severity of the heart disease overrides the financial situation. So the United Network of Organ Sharing, or UNOS for short, separates the urgency of the stages for heart transplant into 6 stages. Stage 6 over here is least urgent. That means their body can currently function and they are very healthy. While stage 1 is most urgent, meaning they are on life support. The people in stages 1 to 3 need the heart transplant to most to survive. So here is, to conclude our argument, we have a polar opposite candidate that we chose, which is candidate E. So candidate E is a father of 3 girls, he's 45, and is in relatively good health. He doesn't drink or smoke, he lives in an upper middle class family with his wife and family. His insurance to cover most of the cost of the surgery is covered with his advertising company, and he's never been in trouble with the law. So this candidate seems extremely great on paper. However, he is currently in great health. He is not urgent for the heart transplant. If you're spending 6 to 12 hours on average to get a heart transplant, we do not need to spend all of that time and money on someone who doesn't need it. Thank you.